Welcome to the Home Health Virtual Training Program, Part 1. I'm Lisa Newton, and I'll be presenting Section J, Health Conditions. I'm a registered nurse with experience in direct patient care, nursing administration, and clinical education in the acute and post-acute care settings. Currently, I'm a senior staff associate at Econometrica in Bethesda, Maryland. Let's begin by reviewing the learning objectives for this session, which are to identify the new and revised assessment items in Section J and describe the intent, coding instructions, and definitions for the Section J items. Section J in OASIS-E has undergone some changes. First, the pain interview in this section is new and includes 3 items: J0510, pain effect on sleep; J0520, pain interference with therapy activities; and J0530, pain interference with day-to-day activities. These items replace M1242, frequency of pain interfering. In addition, the response-specific instructions for M1033, risk for hospitalization, have been revised, and M1400, when is the patient dyspneic or noticeably short of breath, will no longer be collected at follow-up. There have also been some revisions to the fall items in Section J. For J1800, any fall since SOC ROC or start of care, resumption of care, the skip text has been revised and the fall definition has been enhanced for clarity. And for J1900, number of falls, some minor wording changes have been made to help clarify the guidance. This presentation is meant to support your understanding of the revisions to Section J. But as always, the OASIS-E Guidance Manual is your primary reference for coding. Please take the time to carefully review this section in Chapter 3 of the manual to gain a more complete understanding of the guidance. Next, let's review the revisions to M1033, risk for hospitalization. Here is a screenshot of M1033, which is collected at SOC ROC and follow-up. This item identifies patient characteristics that may indicate the patient is at risk for hospitalization. Several clarifications have been made to the response-specific instructions for M1033. In response 3, multiple hospitalizations, was clarified to define hospitalization as the patient being admitted for 24 hours or longer to an inpatient acute bed for reasons other than diagnostic testing. In response 5, a decline in mental, emotional, or behavioral status is considered a change in which the patient, family, caregiver, or physician has noted a decline, regardless of the cause. A decline can be temporary or permanent, and physician consultation may or may not have occurred. Response 7 was clarified to indicate that medications include prescribed and over-the-counter, or OTC medications, nutritional supplements, vitamins, and homeopathic and herbal products administered by any route, and as noted on the reconciled medication profile. Medications may also include total parenteral nutrition, or TPN, and oxygen. And please note that a dash is not a valid response for this item. Now let's review the pain interview, items J0510 through J0530. The intent of the pain interview items is to assess the effect of pain on sleep, pain interference with therapy activities, and pain interference with day-to-day activities. The assessment of pain is not associated with any particular approach to pain management. As we know, the use of opioids is associated with serious complications. So there are a wide variety of successful non-pharmacologic and non-opioid approaches to pain management that may be considered as alternatives. This slide provides a list of other pain management strategies that can be utilized. This is not an all-inclusive list, but it does identify many available alternatives. They include non-narcotic analgesic drugs, transcutaneous electrical nerve stimulation, or TENS therapy, supportive devices, acupuncture, biofeedback, application of heat and cold, massage, physical therapy, nerve block, stretching and strengthening exercises, chiropractic, electric stimulation, radiotherapy, and ultrasound. As you can see from the modalities identified, a wide variety of approaches to pain management are available. It is important to have a sound understanding of the definition of pain when coding the items in the pain interview. As defined in the guidance, pain is any type of physical pain or discomfort in any part of the body. It may be localized to one area or may be more generalized. It may be acute or chronic, continuous or intermittent, or occur at rest or with movement. Pain is very subjective, and this is an important aspect of the definition of pain. Pain is whatever the experiencing person says it is and exists whenever they say it does. The response-specific instructions for the pain interview include the following. First, the assessing clinician should give an introduction before starting the pain interview. Suggestive language might be something like, I'd like to ask you some questions about pain. The reason I am asking these questions is to understand how pain affects your sleep and activities. This will help us to develop the best plan of care to help manage your pain. Then proceed to directly ask the patient each item in J0510 through J0530 in the order provided. As you are conducting the pain interview, if the patient seems unsure or hesitant, use other terms for pain or follow-up discussion. Some patients avoid using the term pain, but they may report that they hurt. Patients also may use other terms such as aching or burning to describe pain. If the patient is unsure about whether the pain effect or interference occurred in the 5-day time interval, prompt the patient to think about the most recent episode of pain and try to determine whether it occurred within the look-back period. There are several important coding concepts to keep in mind related to the pain interview. The items J0510 through J0530 are completed at SOC, ROC, and discharge from agency. If it's a SOC-ROC assessment, it should be completed as close to the time of SOC or ROC as possible. If it's a discharge assessment, complete the pain interview as close to the time of discharge as possible. And the pain interview items should always be coded based on the patient's interpretation of the provided response options for frequency. If the patient is unable to decide between two options, then the assessing clinician should code for the option with the higher frequency. Now let's look at each item in the pain interview, beginning with J0510, pain effect on sleep. Here is a screenshot of J0510. The response-specific instructions for J0510 are the following. Read the question and response choices as written. It is very important that no predetermined definitions are offered to the patient. The response should be based on the patient's interpretation of the frequency response options. If the patient's response does not lead to a clear answer, repeat the patient's response and then try to narrow the focus of the response. To make this a little clearer, let's look at an example for J0510. In this example, the assessing clinician begins by asking the patient, over the past 5 days, how much of the time has pain made it hard for you to sleep at night? And then reads the response choices for the item. The patient responds by saying, I always have trouble sleeping. Then the assessing clinician might reply, you always have trouble sleeping. Is it your pain that makes it hard for you to sleep? In this example, the patient's initial response did not lead to a clear answer. The patient responded actually with a statement, not an answer to the clinician's question. So the clinician repeated the patient's response, which was, "You always have trouble sleeping," and proceeded to narrow down the focus of the response with an additional follow-up question. Now let's review the coding instructions for J0510. For this item, you ask the patient, over the past 5 days, how much of the time has pain made it hard for you to sleep at night? The response options include code 0, does not apply, if the patient responds that they did not have any pain or hurting in the past 5 days. Code 1, rarely or not at all, if the patient responds that pain has been present and the pain rarely or not at all made it hard to sleep in the past 5 days. Code 2, occasionally, if the patient responds that pain has occasionally made it hard to sleep in the past 5 days. Code 3, frequently, if the patient responds that pain has frequently made it hard to sleep in the past 5 days. Code 4, almost constantly, if the patient responds that pain has almost constantly made it hard to sleep in the past 5 days. Code 8, unable to answer, if the patient is unable to answer the question, does not respond, or gives a nonsensical response. And dash is not a valid response for this item. It's important to understand the key difference between code 0, does not apply, and code 1, rarely or not at all. For code 0, does not apply, the patient reports that they've had no pain or hurting in the past 5 days. For code 1, rarely or not at all, the patient reports that pain or hurting has been present in the past 5 days, but has rarely or not at all impacted sleep. This is an important distinction when coding this item. If the patient reports they had pain in the past 5 days, and the pain does not interfere with the patient's sleep, for example, because the patient is using pain management strategies successfully, then code 1, rarely or not at all. Now let's discuss J0520, pain interference with therapy activities. Here is the item screenshot for J0520. Important for coding this item is an understanding of rehabilitation therapy as defined in the guidance. It is a special healthcare service or programs that help a person regain physical, mental, and/or cognitive abilities that have been lost or impaired as a result of disease, injury, or treatment. Examples include physical therapy, occupational therapy, speech therapy, and cardiac and pulmonary therapies. The response-specific instructions for J0520 include the following. Read the question and response choices as written. No predetermined definitions are offered to the patient. The response should be based on the patient's interpretation of frequency response options. And again, this is a very important concept to coding. And confirm that the patient has been offered rehabilitation therapies during the reference time frame. For this item, please note that rehabilitation therapies may include treatment supervised in person by a therapist or nurse or other staff, or it may be the patient, family, or caregivers carrying out a prescribed therapy program without agency staff present. Now let's review the coding instructions for this item. When coding J0520, you ask the patient, over the past 5 days, how often have you limited your participation in rehabilitation therapy sessions due to pain? The response options include code 0, does not apply, if the patient responds that they did not participate in rehabilitation therapy for reasons unrelated to pain. So for example, if therapy wasn't needed or they were unable to schedule it in the past 5 days. Code 1, rarely or not at all, if the patient responds that pain has rarely or not at all limited participation in rehabilitation therapy sessions in the past 5 days. Code 2, occasionally, if the patient responds that pain has occasionally limited participation in rehabilitation therapy sessions in the past 5 days. And as noted on the slide, additional coding response options include code 3, frequently, code 4, almost constantly, and code 8, unable to answer, if the patient is unable to answer the question, does not respond, or gives a nonsensical response. And please remember that dash is not a valid response for this item. The last item in the pain interview is J0530, pain interference with day-to-day activities. Here is a screenshot of J0530, and the response-specific instructions for this item are as follows. Read the question and response choices as written. No predetermined definitions are offered to the patient, and the response should be based on the patient's interpretation of frequency response options. Let's review the coding instructions for J0530. When coding this item, you ask the patient, over the past 5 days, how often have you limited your day-to-day activities, excluding rehabilitation therapy sessions, because of pain? The response options are code 1, rarely or not at all. If the patient responds that pain has rarely or not at all limited day-to-day activities, excluding rehabilitation therapy sessions in the past 5 days. Code 2, occasionally, if the patient responds that pain has occasionally limited day-to-day activities, excluding rehabilitation therapy sessions in the past 5 days. And as noted on the slide, additional coding response options include code 3, frequently, code 4, almost constantly, and code 8, unable to answer, if the patient is unable to answer the question, does not respond, or gives a nonsensical response. And again, dash is not a valid response for this item. Now let's move on to discuss the fall items, beginning with J1800, any fall since Sock Rock. As noted earlier, the fall items are not new to OASIS-E, so we will just briefly touch on the changes. For J1800, any fall since Sock Rock, an item rationale for falls has been added, describing that falls are a leading cause of morbidity and mortality, and the fear of falling can limit an individual's activity and negatively impact quality of life. This slide also depicts the screenshot for J1800, and please note that the skip pattern for this item has changed in OASIS-E. A coding tip has been added to J1800 regarding the need to report falls that occur at any time during the quality episode, regardless of where the fall occurred. So for example, a fall that occurred at the doctor's office during the home health quality episode would be reported. However, a fall that occurred during a qualifying inpatient facility transfer, for example, transfer to a hospital or a skilled nursing facility, would not be reported, as it did not occur within a home health quality episode. Another change is that the fall definition has been revised. The reference in the definition regarding an anticipated loss of balance resulting from a supervised therapeutic intervention has been enhanced for clarity. And as noted earlier, for J1900 number of falls, only minor wording changes have been made to enhance the overall clarity of the guidance for this item. Please take the time to review the OASIS-E guidance manual to ensure that you have a complete understanding of the revisions and enhancement to the fall items. So in summary, several changes have been made in Section J. The response-specific instructions for M1033, risk for hospitalization, have been enhanced. The pain interview, J0510 through J0530, is new, and will replace M1242, frequency of pain interfering, J1800, any fall since sock rock, includes revised skip text, and the definition of a fall was enhanced for clarity, and M1400, when is the patient dyspneic or noticeably short of breath, will no longer be collected at follow-up. We've covered a lot of information in this session, and you may find that you have questions about the content. If you would like to submit a question regarding this presentation, please send it to pactraining@econometricainc.com by August 31st, 2022. As a reminder, a practice coding workshop will be held in September, and we encourage you to attend. Select questions will be answered in a Q&A session during the September 2022 virtual live event. Thank you for reviewing this presentation, and we look forward to your attendance at the coding workshop.